Committee of the Whole is now back in order. Colleagues, we are on the second round for the Guam Memorial Hospital under Chapter 3 Health. At this time, I will recognize Speaker Frank Bluss Jr. Thank you, Speaker. Senator Gumatautau. Senator Barnett. Sure.
Hey, Magaʹhågan, Mr. Chair, and good morning to the panel. Thank you for joining us so bright and early on this Viva Lunes. And yeah, I have no real questions, but I just wanted to thank you. And I don't know if the rest of my colleagues kind of losing track of what day it is, but it is Monday, and Magaʹhågan to the people of Guam. Good morning.
Sisusmasi, Senator Barnett. Senator Guåhan. Okay. Senator Guåhan. Senator Sabrina Salas-Mantanani, and time has been yielded to you from Senator Guåhan, so you have 20 minutes.
Okay. Thank you, and good morning, everybody.
My bad. Violated my own rule. You have 10 minutes. It's 5 minutes in the second round. It has been a long 7 days. Sisusmasi.
I wanted to go over your social cases and just an update, because I know there had been mention of the possibility of opening a facility in Tamuning. And so what again was the total cost you've accumulated, and then how much you anticipated to save perhaps once this new facility opens, and when is it opening officially?
I'll let you guys speak in terms of how much. I mentioned yesterday about $50 million cumulatively, but I can't remember the years that has, started accumulating. In terms of the new facility or the facility that has been acquired and proposed for a transition assisted living facility is what it is called. And the intention initially was for our cases who no longer need medical care, need to be in the hospital, but need to be in a place where there are people who will help them. Unfortunately, that has not then met our needs. The criteria has been changed for where the individuals are supposed to be ambulatory and have some independence in taking care of their needs, but they just need some help, not necessarily by nurses or licensed people. So therefore, the 20 individuals who are currently at our acute care hospital and at SNU who are in that criteria of social cases, they won't be able to transition into that home. Because some of them are not ambulatory, some of them have like feeding tubes. And so, we teach families to take care and to feed their loved ones who are at home with feeding tubes, but unfortunately this facility may not have the staff, is what we're being told. It is currently also being retrofitted with to meet ADA guidelines, so it's not yet ready to be open. The elevator, there is a shaft, a framework for it, but I'm not sure that has been completed, getting that elevator in, because it is a 2-story facility, and it needs to have that elevator for access of those individuals going up and down their rooms and to the laundry area and to a common area of a kitchen. So that, I understand, is not yet ready to be opened. In terms of the costs of the social cases, I'll let you guys speak on it more. Thank you.
Right now, on our receivables, the social cases make up about $55 million of our receivables. So every day they are incurring at least a room and board charge of about $2,000 a day. Some of them require additional services, hemodialysis, medications, and what have you. So, but it's at least $40,000 to $50,000 a day that they're incurring.
How many patients? How many social cases?
About 21 is what we're ranging. Sometimes, like we've had a few individuals have passed away, but then replaced by other individuals who no longer need medical care.
And again, because I know we've been hearing about this new facility, is it still, from what you understand, targeted to open September, October?
We were told several months ago that it was going to be ready in 3 months, but it's already past 3 months, and it's still not ready to be open. It is under the administration and management of Department of Public Health and Social Services.
And again, I'm not sure if I heard correctly. What was the anticipated savings for GMH, or is there any anticipated savings?
At least $50,000 a day.
A day, okay, all right. I also wanted to follow up on something that was mentioned last night regarding foreign doctors, and maybe Dr. Eusebio, you could answer this and maybe clarify. I'm not sure if my colleague, Senator Taitigui, had presented the draft legislation that she was working on related to foreign doctors, but if you can provide any clarification as to whether allowing foreign doctors to practice at GMH could compromise any sort of reimbursement from Medicare.
The Medicare issue is certainly significant and needs to be understood. And that is the reason why the focus is on pediatrics and OBGYN, because those patients do not require or do not use Medicare at all. The problem is when you charge Medicare, there's a requirement that Medicare says that if you that the hospital that charges for this patient has to have a physician that's trained in the United States, so that's the only way you're going to get reimbursement from Medicare. Now, since pediatrics and OB don't don't utilize Medicare, that's how I was thinking to utilize those physicians.
What about utilities? Is GMH behind in their utility bills? If you could kind of break that down.
Yes, we are behind.
What's the amount and how far behind?
1.6 million for power, and I believe 250,000 maybe for water.
And how far behind for power?
Power is, we owe from January to current. Water is, I believe, May.
Have you
May.
engaged or in any sort of payment arrangements or been threatened for disconnection?
We have been threatened with disconnection, yes. But they haven't disconnected us, but they are requiring payment as of today.
As of today?
We
So
need to pay them.
if you don't pay the entire bill today, you will be disconnected? And are we talking about power or are we talking about water?
Power, I think they've given us a disconnection notice. Water, no, but they are requesting us to make the payment. But power, we have a disconnection warning.
So what's the plan? Are you planning on making a payment today? Or
That is the plan. We try and pay, but until we have more cash, then we're not able to pay right now.
are you having to pay the 1.6 million for power today? Or just a partial payment? Or do you
Last
plan on
time,
signing a?
we paid 1 month because our monthly bill is around $250,000, and we were able to make at least 1 month payment, and then we fell behind again. So we're trying to at least pay the January amount, and that's about $250,000. And then they don't bother us, but then later on, when it's reported to their board on how their aging is, they reach out to us and say, we need to make a payment. But they don't say exactly how much.
They don't tell you how much to pay? Is that what I heard?
Well, for example, they don't say we have to pay the whole amount or they'll disconnect us. They just say they'd like to at least get a payment of something. So we usually schedule a monthly payment, which is right now $250,000 will cover the January invoice.
Okay. When you guys appeared before the legislature for your budget oversight hearing, You had presented your plan, and it included a potential cost containment strategy. Are you still looking to implement any of these proposals? It was decrease total FTEs by up to 10%, contract rent outpatient clinic space for cardiology, gastroenterology, pulmonary, explore outsourcing services, and so on.
We are exploring that. We are still just talking about it. We had a directors meeting last week, Friday, and we assured them that we're working with the legislature because we do not want to furlough. We do not want to cut employees, especially given with our patient care census. It's been high, and so not only do we need the clinical staff, but we also need the non-clinical staff. They're just as essential. Environmental services, FM, the billers and the coders, we need them, and so as much as possible, we want to avoid the furlough. But if anything, if we don't get the funding, then we may not have that choice but to then start the furlough process. In terms of the outpatient clinic, that is really not our primary mission. Our primary mission is acute care inpatient services. Outpatient, we are providing it because, for some reason, like cardiology, gastroenterology, pulmonology, those are services that are not easily and readily available out in the community. So we're making it available, particularly for upon discharge, these patients have access to a follow-up care for their pulmonology, cardiology, and gastroenterology. We also do still outpatient rehab. We do radiology procedures on an outpatient basis. The laboratory services, we do that on an outpatient basis. So we need to continue those services.
Understood. I'm just going to ask one final question and really just give you the opportunity to just speak your mind. Every time in the headlines, really all we hear about is the new hospital, money going to the new hospital, and very rarely and seldom do you hear, this is what we're going to do for the current hospital because it is falling apart. So really, Lillian, I'll start with you. What is your reaction when you hear that? When it doesn't seem like there's enough attention being placed or even the hospital being prioritized?
We are paying attention to keep the hospital operational because we realize that, building that new hospital, yes, it's a great goal and we need it, but in the meantime, we need to keep this current hospital operational and functional to continue the services because we don't know, it may be more than 5 or 7 years. We need to keep it. The facility is falling apart. And our FM people continue to repair on a daily basis. We do have the mold issue that needs to be repaired, but we need to crack the walls open. We need to repair the roof and the envelope so that we don't get any more leakages that then just, exacerbates our mold condition. So yes, we need to, and I will say this, we need to keep the hospital functional and operational and to the best that it can while we're waiting for this new hospital to be built, because I do also agree that we need that new hospital. Thank you.
And I don't think anybody disagrees, right, that we need a new hospital. And I'm just wanting to hear your feedback on how you're having to work in a hospital, though, that's continuing to fall apart. Dr. Eusebio?
The success of the new hospital is based on the success of the current hospital. Because what's going to happen is if we take the same problems that we have with the current hospital, it's going to be the same problems as a new hospital. So if we don't figure out how to fix the current hospital, it's going to be the same problems and it's going to fail.
Thank you. Mr. Kenga?
I happen to agree with Dr. Eusebio. I just joined the organization in February, and it's been a wild ride for 5 months. I've seen it all. Fire, flood, death, even surprise inspections by CMS. And at the end of this last inspection, we have corrective actions that were issued to the hospital that put at risk our ability to continue to bill Medicare and Medicaid. And those particularly include refurbishments to our facility. What this budget bill proposes for the hospital don't give us a meaningful opportunity to address those discrepancies. And we're really pleading with the legislature, wherever you can find the funds to give the hospital, to please do so. You've heard in the past agencies talking about lapses. That is not a reality of GMH. There is no excess cash that we have not obligated. And as much as agencies have asked for continuing appropriations, maybe we can consider a new environment where any unencumbered or unexpended funds from other government agencies be appropriated to GMHA to cover our shortfall. I mean, those are the realities that we face today, and we don't have a challenge spending money. If you gave GMH $10 million today, that would be gone in a blink. And vendor payables, payroll, paying our contracts, taking care of our facility, you name it, there are a whole host of things that we can think to pay, but we simply don't have the cash. So we kindly ask for this body's indulgence in trying to find that and give us a meaningful opportunity to succeed and not just try to make the most out of nothing. Thank you, Senator.
Thank you. Jordan?
Sure. I'll reiterate that I think that all of us up here fully endorse a new hospital and the plans that are coming up, but at the same time, we have to take care of as Dr. Eusebio has repeated over and over again, we have to take care of the patients that we have today. I've been at the hospital and for 2.5 years now, and right after I joined, we had Typhoon Mawar, and unless we're able to actually maintain the facility and do these things, I'm afraid that like one more typhoon comes in and we're going to have some real struggles to deal with if we don't have the capital improvements and stuff to fix some of the repairs. We've made some substantial progress on some of those repairs and some of the contracts and things for that, but we just need to actually have the resources to follow through on that, because patients aren't going to wait for a new hospital to get sick. They're sick today as well, and we need to keep taking care of them. And I'm actually always in awe of the work that the doctors and nurses do at GMH to take care of these patients. They're really the reason I keep waking up every morning to do my job, because I get to watch them really perform some miracles. And it's tough sometimes. We don't always have supplies. We don't always have the greatest facility and other things, but they really do the great work, and I want to make sure that we can actually give them the facility and supplies to keep doing that work.
Thank you. Christine?
Hi, thank you. I think as long as our TEFRA reimbursements continue to be lower and our Medicaid follows, I think we're going to continue to have challenges and rely on funding from the government. But Senator, may I read something short? Okay. Not only am I a healthcare administrator, but I'm also a nurse who has witnessed firsthand the dedication of our hospital staff and the increasing challenges we face in delivering safe, effective, and compassionate care to our patients. Our hospital is a lifeline for thousands of residents, especially the most vulnerable among us. We provide critical services regardless of a patient's ability to pay. However, we are now at a tipping point. The cost of providing health care has risen dramatically in recent years. Medical equipment, supplies, and pharmaceuticals have all increased in price. In addition to these core expenses, we are also facing higher utility costs, including electricity and water, as well as rising premiums for insurance and retirement contributions for our staff. Equally important, we are in the midst of a nationwide shortage of healthcare personnel. To recruit and retain qualified nurses, physicians, and other healthcare professionals, we must offer competitive compensation and invest in training and wellness programs. If we cannot meet these needs, we risk losing talented professionals to private institutions or off-island at the expense of our patients. Despite these mounting challenges, our budget has not kept pace. We are being asked to do more with less, and quite frankly, that is no longer sustainable. I urge you to consider a significant increase into the budget allocation for Guam Memorial Hospital Authority. The funding will allow us to modernize and maintain essential equipment and facilities, secure reliable supplies for medication and critical materials, pay for rising utilities and insurance premiums, ensure our employees receive the benefits they deserve, and protect patient safety and improve their patient outcomes. As the only civilian hospital on island that delivers babies and admits pediatric patients, we carry an extraordinary responsibility. Every mother in labor, every child with a medical emergency, they all come through our doors. We are often their only option, especially for neonatal intensive care and pediatric intensive care units. But this essential care is now at risk. An investment in our hospital is an investment in the health and resilience of our community. With your support, we can improve the quality of care that all our individuals on our island deserve. Thank you.
Thank you, Christine. Zaldi?
Good morning, ma'am. Speaking for the utilities and the structure that we have, as you all know, it's more than 50 years old. Every day I come to work, it's a miracle that we have all the utilities being provided and we're able to operate. And we would like to better ourselves, not only for GMH, but for the services that we provide. We'd like to be at par with the rest of the providers, but we want to have the support to fully provide the environment of care that we would like to provide, safe and secured. That's it.
Rodelin?
Good morning. Just to reiterate what everyone has already said, we cannot overemphasize how much your support is needed at the hospital. We struggle every day with the lack of supplies, trying to figure out, okay, this vendor cut us off, how are we going to pay in order for us to get the supplies, and when we don't, because we're cut off by certain vendors, we're having to unfortunately procure the items that are more expensive, which of course then hits our bottom line, which further exacerbates our issues. And so not going into all the points that everyone has already said, again, we just cannot overemphasize how much we need this body's support. Thank you.
Yuka?
I am very excited about a new hospital, really. Who isn't? But really, we cannot forget what's happening now in the hospital now. I cannot even stress more how much really what Rodelin said is really true. We really need your support. Right now, you asked me about the power bill. I'll pay the power bill today, but that means I can't pay something else. So it's not like there's extra cash. It's always moving. Robbing Peter to pay Paul kind of issue because our funding is so limited. And I have really good staff. I mean, in the last 2 to 3 years in our billing and collection department, we've come leaps and bounds cleaning up the aging, having to deal with network shutdowns with no system to bill. I mean, it's been quite a struggle, but they always bounce back and they understand how important it is for us to bill and collect, because that's what you guys are always asking us about. How's your billing? How's your collection? They know that. So they're always pressured every day to get those claims out, to make the calls, to get people on Medicaid, to get them on payment plans. We're doing everything we can. We're working with Medicare to get our rate up, but that's taking some time. So in the meantime, we really do need your support to keep the hospital going. And we do see miracles happen every day. Zaldi and his team perform miracles keeping that facility open. I cannot tell you. You walk in there, especially on a rainy day, you know what it's like in there on a rainy day. Even when it's not raining, the elevator's not working, something is falling apart. We can't get supplies because the vendor cut us off. And Rodelin's right. They're asking me to recertify a requisition because we have to go to vendor number 2, vendor number 3, who's charging us 2 or 3 more times higher than what we would have normally paid. But we have no choice. We need the supply to save the lives of patients, to keep the patients safe, to even keep the employees safe. So that's what I struggle with every day with the cash. It's not that we don't want to pay the vendors. Believe me, that's not it. It's just if we only have so much cash, it's about prioritizing, but everything's a priority. We have to pay the power, we have to pay the water, we have to pay the employees, payroll is also a priority, and the suppliers, our doctors, we have to pay our doctors. Our nurses, we've had big challenges with recruitment and retainment, and since the pandemic, we've had so many pay increases, we've had to offer so many incentives to get nurses into the hospital because we're competing with GRMC right down the road, and even with off-island hospitals, a lot of nurses choose to leave the island because they think opportunities are better in the States or their families are all relocating, and so we have to entice them to stay here. So that's another challenge we have that costs money. So again, I really, really ask your support to keep the hospital going until we get the new hospital, which is what we predict about 5 to 10 years down the road. So we really need to keep this hospital going. Thank you.
Thank you again for coming here today. That was just really all I wanted to do, was just give you an opportunity, your final pitch to the legislature, and also let you know that we're all listening to you, and we'll be taking into consideration everything that you've said over the past 2 days. So thank you so much.
Sidus Masi, Senator Montanani. Ranking Member Tina Rose Muñoz Barnes, you're recognized.
Manana Sizos, Mr. Chair, I spent a lot of time last night asking a lot of the questions, so I'm going to go ahead and yield my time back and wait for the amendments to come forward. Thank you. But thank the panel for being here this morning and late last night. Thank you.
Sidus Masi, Ranking Member, for your comments. Shelley Vargas Calvo, Senator, you may proceed.
Sidus Masi, Mr. Chair, good morning once again to everyone. And I just wanted to say hi to the people of Guam, and I want to thank the panel that's been here in the last many hours, days, to answer questions. I think pretty much we have heard so much deliberation with regards to this issue, and I really have no further questions. We have all the facts, we have all the statements that you have already offered, and so I do just want to thank you guys for your time and for all your hard work. And I know that you guys have been trying your best to balance everything, and the same thing on our side, but I do hope that at the end of the day, everybody will walk away happy and content, because that's what we do, right? We're all resilient, we just roll with the punches, and we just have to do what we have to do. And on that note, Mr. Chair, I thank you for the chance to speak up and to thank the panel, and I yield the rest of my time.
Sidus Masi. Speaker, can you take the mic? The chair.
Mr. Chairman, you have the floor.
Sidus Masi, Mr. Chair, and I don't have any questions. I just wanted to share with you the family of GMH. You know, for years now, we've heard your pleas. For years, we've watched as typhoons come, conditions get worse. You know, many of you know the intricate relationship I have with the hospital. I live across the street from it, basically. I see it every day, and my wife toils over there saving lives. I'm deeply saddened because I don't think that it requires a fight to do what we need to do. I think it requires leadership. I think it requires hearing your pleas, but also working with you, because it's never going to be a one-way street. This legislature a few years ago, jumped to the opportunity when many of your colleagues came down here and had a heartfelt plea to us. One nurse basically breaking down. And we jumped and we appropriated $30 million, and I know it was well received by you folks, and you did, deal with that aging and got back on your feet. And then we appropriated more money. And another supplemental of $20 million. And unprecedented now, from 3.7 million years ago to the reality of the 30, 40, now close to $50 million that GMH needs to operate. Please don't take this wrong. This is not trying to pit the legislature against the governor's office. There's a lot that's happened in the last 7 days. There's a lot of back and forth, and it's going to continue until we vote on this budget. But I want you to know that, as it was discussed in the opening, $7 million is not insignificant, but that's really the difference between this legislature and the governor, the fiscal team. Unless we do something within these revenues, like going in and slashing and burning in other agencies, or there's really no miracle of going in and raising the revenues, because it's just not there. We agree on the revenues. Lester and I, we've had our back and forth, but one thing we've said is we agree on the revenues. So I hope that some of the proposals that have been put together by our colleagues here, because I want you to walk away from this understanding the truth. It's going to take outside resources, other funding sources, other non-appropriated funds to get you close to what your ask is and what your need is. I know when you guys come down here, folks say it's an ask. I know it's not an ask, it's a need. We know that. But structurally in this budget, and this BPT discussion, it will happen. It shouldn't apply to you. You just ignore the noise. The truth is that it'll happen here, and we'll figure that out. But the truth is that even with that, even if I don't see it coming off the table, it's going to go down. The governor have to deliberate it. But that is not even a magic bullet, because even those sources that are contemplated were, kind of beat down by our folks on the other side of the aisle as that's not an effective source of revenue for what you're trying to do. So even if that were to become a successful source of revenue, it would still be, between education and yourselves, it's $100 million. It's not there. So the truth is, we're going to do our best. And the truth is, what's going to happen here in another few minutes, maybe a half hour, is the discussion will begin. And it will entail outside revenue from this budget. Hopefully be adequate, hopefully can pass. But that's what you'll be walking away with, is the knowledge that what we're going to have to do is find that revenue from other sources, and hopefully the governor will see it fit that those revenues are there. God bless you. Pray for us, we'll pray for you. This is Mr. Chair.
Thank you very much, Senator. Colleagues, that concludes. Senator, I apologize, ma'am. You can.
Mrs. Maciel, and I appreciate that. And thank you again for all of you from GMH for your hard work and for being here this morning. I only have 5 minutes. I'll be really fast. First of all, Steve, if you could tell us, is there any local funds in the 21st Century Healthcare Center of Excellence Fund?
Senator, from the information I received as of yesterday, is when I got the information, there are no funds that were deposited into the 21st Century Fund of Excellence. Nothing was ever deposited into that fund.
All right, well, that's too bad, because that's what's a potential source, right, that we're looking at. But so I just want to clarify, so last year, the legislature gave about 57 million to GMH total, including the supplemental. This was about 27 more than what GMH received in FY24, and about 26 million more than the FY25 governor's request. This year, the governor's request is about 4 million less than that amount from FY25 that you actually received. And the committee's proposal is to give about 6.7 million less than the governor's request and about 10 million less than what GMH actually received in FY25. So you said yesterday, Mr. Kenga, that the budget is 28 million short. Well, you all said that, but that it's short to make payroll. Can you clarify, you would need it for payroll or you need it for all operations?
So it goes through all operations, Senator. The 28.2 million dollars reflects our total operating budget, factoring net patient revenues and other fund sources. There is a difference of 28.2 million dollars.
So some people will not get paid?
The reality is, unless we look at our contracts, I think Yuka said maybe we could find 500,000 here, 200,000 there, but nothing meaningful to bridge that $28 million gap. The reality is payroll will be affected if this gap continues to exist should this budget bill pass and become law.
All right, so 28 million shortage, and then there was a $29.3 million figure for CIPs. Is that in addition to the 28 million? That's totally separate from the 28 million, is 29.3 in CIPs. Are these critical? Do you really need them right now? Can they be put off? And will they carry us for the next 5 years while we're building the new hospital?
Absolutely not, Senator. And I'll tell you that
Absolutely not what?
That we cannot survive without putting some money into our CIPs. I mean, we're talking about replacing our power panel, our electrical panel, our EHR system, and our IT infrastructure. So those continued delays lead to inefficiencies. We have to recruit more billers. So there's a team of 30 today because our IT system is so antiquated. I think if we can move and give us an appropriation to rehabilitate and update our systems, we wouldn't need manual labor and might find some cost savings there.
All right, and then there was also a figure of 25 million in accounts payable, right? Is that in addition to the 28 million and the 29.3 million in CIPs?
No, ma'am. That's what's happening right now. So we're talking about the budget for next year. The AP is what's happening right now.
All right, what do you expect your APs to be with going in next month?
Probably the same.
Right, so that's why I'm asking. Is that in addition to the 28 million that you need for operations and payroll, and in addition to the 29.3 that you need for CIP projects, you need 25 million to take care of these accounts payable? Or if we gave you the 28 million operations, you're going to take care of the accounts payable?
Yes.
Which?
We will use it to pay the accounts payable because that's the priority.
And then how about
right
your
now.
payroll?
That's the cash balancing act that happens every month, Senator.
So do you only need one set of 28 million, I'm asking? One for payroll, and it will take care of your accounts payable, or do you need two?
There should be two, and there should be a distinction of what amounts are allocated to cover accounts payable versus amounts to cover payroll or operations.
Well, I'm worried about the accounts payable. Yeah, I feel like if we give you a lump sum, you might not pay those accounts payable, and I'm not sure. I want to trust your judgment, and let's see. But so what we're looking at is there's just a little bit of money that we've been able to find in here during our deliberation. FY23 excess, as you saw in the bill, 5 million of that's going to the hospital, 10 million of that excess going to GVB. FY24 excess was given to you in the last supplemental bill, and they say there's no more funds left in FY24. FY25, we've been told there's only 4 million left after the amendments were passed in this bill for Simon Sanchez, the Rainy Day Fund, and the Guam Cancer Trust Fund. So hoping we can get to the 4 million, but that's nowhere near the 28 million for payroll, the 29 million for CIPs, or the 25 million for accounts payable. So I think we're desperate for a solution here, or I don't know, I think there's a disconnect that you need to talk to the governor also, and us, and see what maybe they don't believe that it's really important, or it's really a priority, or that you're really going to let go of people, or you're really or that we just go continue to not pay these accounts payable. Maybe you need to prioritize them. Which ones, if we pay, we're going to get better service, medical services in the hospital? Which ones, if we pay, are going to help the nurses and the people who are doing the patient care? Which ones, if we pay, and which ones you're proposing not to pay? I don't know, but we're short. So,
Senator, if I may just add, you may have missed it earlier, but when Senator Matanani was asking for a solution or just for our final plea, one of the suggestions was to make a hard decision to say, for the fiscal year 2026, you will not entertain any continuing appropriation amendments for any agency.
I know, I heard that you said all the other agencies would give their continuing, whatever they didn't spend in FY25
Correct.
to you. Yes.
I mean, you're seeing some agencies, Senator, that we're well into the fiscal year with 3 months remaining, but only spending just half of their budget. I mean, I don't think that you can foresee that they spend 50% of their budget.
All right, I accept that suggestion. However, yeah, as you may have watched, GDOE, they have continuing appropriations they were unable to use, but they absolutely need those for the students. So it's going to be case by case, right?
Absolutely.
The CDBG, they talked about this disaster recovery plans. I know you guys put in comments or asked requests. That's good. But my understanding of that is, you said the application is due in January, but it sounded to me when I went to those meetings that they were not going to actually give out awards maybe for 5 years. Is that your understanding too? So this is not going to help us in FY26, in other words. Do you expect, if you got awarded from the CDBG-DR, that you would get anything in FY26?
The way I understood it was that the applications were due in January, but it was not clear as to when they would come up with their decision and, as far as how much or anything like that. The way I understood it is that of the $500 million for the CDBG-DR, there are certain, parameters, and so they kind of carved out certain amounts for certain things, and then there's a portion there for I believe it's community infrastructure, and if my understanding is correct in our discussion with Mr. Esteves over at Guåhan, that's where we would fall under. It would be the community infrastructure portion, and I understood that I think it was $50 or $60 million that was set aside or identified for specifically for the A&E for the new hospital. But yeah, specifically for our immediate needs now, my understanding is it would fall under the community infrastructure, which we would then have to apply for. So it's still not even a guarantee that we would get any of those funds.
Right, not guaranteed, and I think definitely not in FY26, the way they presented it. But, so again, we have one suggestion to cut all the other agencies from their continuing appropriations and give that to GMH. The bill says give them the governor can transfer from these other critical agencies and give to GMH, or we can address our revenues, right? And increase what revenues we have coming in, or ensure that we can keep some of the revenues coming into us so that we can address GMH, right? Thank you. Thank you, Mr. Chair.
You're very welcome. Okay, I think that concludes the second round. Thank you very much to the panel for being here. We're going to go ahead and take a recess so that we can reset ourselves for a third round to deal with the amendments. Okay? So with that, on behalf of my colleagues, I want to say thank you very much. Okay? All right, we're in recess. Morning, colleagues. We have, before we start with the amendments, we have asked Lester Carlson from BBMR to come in to be able to so we can ask him some questions with regards to some of the appropriations that should have occurred before. So until such time that he does show up, we'll continue to remain in recess, but we are already in chapter 3. I mean, round 3, okay? So we stand in recess.
Holiday colleagues, we've been notified that the representatives from the governor's office fiscal team will be coming down for the committee of the whole. The purpose of this, colleagues, is to discuss the $35 million appropriation that is currently in our fiscal year 2025 budget and the proposed amendment by one of our members to appropriate that to the hospital, seeing as how we are not planning to go to market this year for GMH. So we stand in recess. Committee of the Whole is back in order. Folks, we are in the third round for amendments or comments, and you have 5 minutes, and we do have several amendments, so we'll get started right now. The first amendment is, you will read, it is SSM L18P40, and it's proffered by Senator Sabrina Salas Montanani. You may proceed, Senator.
Thank you, Mr. Chair. Before I proceed with my amendment, I'd like to bookmark this particular section.
Yes, consider it bookmarked.
Thank you. This amendment is to amend Section 3, Part 1, Guam Memorial Hospital Authority, Chapter 3 of the bill to read, General Fund Appropriation, the sum of cross out $19,121,000, the sum of $19,121,152 to read $22,771,152 is appropriated from the general fund to GMHA for its operational expenses for fiscal year 2026. So this is a variance of $3.65 million. And so what this does is it basically takes from the Guam Department of Corrections in Chapter 5, and I can read that part. DOC and GMH, a memorandum of understanding for fiscal year 2026, the sum of $3.6 million is appropriated from the general fund to the Department of Corrections to pay GMH per the memorandum of understanding between DOC and GMH for providing health services to inmates. So later on, as we reach Chapter 5, I will be crossing that out. So that will be the offset. But I do want to say, because GMH, they were here last night and they were testifying and answering questions. I did ask a question about this specifically. And so redirecting the $3.65 million appropriation directly to GMH ensures that these funds are allocated efficiently and used specifically for the hospital's needs, bypassing potential delays or misallocations within the Department of Corrections budget. Ultimately, this removes an unnecessary bureaucratic process which involves DOC as a pass-through agency. That's my amendment.
Jesus Monsi, Senator. On the amendment, would anyone like to speak on the amendment? Okay, we will go to a 1-minute recess. There's requests on the floor for BBMR to be in here and OFB. We are in recess. The committee of the whole is back in order. Sarge, can you remind all of the panelists that were previously sworn in that they are still sworn in? So just for the record, everyone knows that they are sworn in on the record at this time. Senator Terlahi, on the amendment.
Sidus Masi, I very much appreciate this amendment. I want the funds to go to GMH because they're providing the services. However, in my memory, I remember, I think we did this years ago, give it directly to GMH, but eventually we had to reverse that and give it to DOC. And I think it's because of their consent decree that this was a mandate that they were trying to comply with, and in order to show that, it was supposed to come from them. But if we can confirm with the panel, if this is, if we did this, is DOC going to be in violation of its consent decree or whatever other requirement that we ended up putting it at DOC directly?
Thank you, Senator Terlahi. When we put this together, geez, maybe 7 or 8 years ago, it was in response to some findings from the federal government about shortcomings with treatment of inmates. So what we ended up doing was creating this MOU. So it's governed by an MOU that has an amount of money appropriated to DOC to cover the costs for the clinic that was actually established at DOC. So when inmates are, they're supposed to have a complete medical record when they're first brought in so that everybody understands what medical conditions they may have as pre-existing, and then any discomfort or illness that they suffer that requires some attention can be handled at that clinic at DOC. It is different than, as was stated earlier, when inmates have to be admitted to GMH. That's a whole nother billing system cycle. But we wanted to try to preempt some of the initial illnesses at the clinic and try to address them in a more proactive manner. So my understanding is that subsequent to the establishment of the MOU, there is a clinic there. It is staffed on a regular basis by GMH personnel who come and take care of whatever inmate illnesses occur. I believe the funds are insufficient as they're currently appropriated, and at the end of the day, GMH ultimately gets everything that's been appropriated for under this MOU. If the intent is to give it to GMH directly and not have DOC administer payments per the MOU, then it might be a departure from the existing MOU.
And Senator, if I could add, it was one of the subjects that was discussed at the meeting I had with GMH last week. And my understanding is that for July, there was a particularly high payment required under the MOU because of an expensive drug that was needed at that time, which obviously was passed through to DOC, but it was above and beyond the usual amount that is the subject of the MOU by about $200,000.
But do you see any problem of it being put to GMH instead of DOC directly?
I wasn't here when that decision was taken that you referred to in order to satisfy the consent decree, and I would have to research that. But I can see that if there was a consent decree, that would be the solution.
Yeah. Mr. Chair, and then just on before I get there. Mr. Carlson, so GMH claims they have not been receiving this money from DOC for quite a while. Is that correct?
I believe they might be confused with the inpatient billing versus the clinic billing. Mr. Byrne could probably shed some light on that.
They have been receiving it, albeit slowed down by the process at, or the verification process at DOC. But Mr. Carlson is quite right that there have been a number of inpatient billings which DOC are a fair way behind in satisfying.
All right. Okay, I would support the amendment of giving the funds directly to GMH, but I'd like somebody to clarify if this is okay with the consent decree, first of all. And second of all, I feel like if we are taking this money from somewhere else in the bill, we need to do this together. It has to be, otherwise we're going to end up like, what if our decision on that part of the bill is different? And it should be treated as a whole, and I'd like to do that if that's the intent and that's the source of money. Otherwise, it's by this amendment alone, it's not clear where the money is. So I would just ask that the author be allowed to add that here, and we deal with it as a whole. Otherwise, there are insufficient funds for this.
Yeah, Senator, on the advice, OFB, can you let the senator know what you advised us with regard to this offset, if this amendment should pass, because the senator bookmarked this area because we're not in Chapter 5 right now. So it's been bookmarked in order to make the transition, which means if this amendment passes, then when we get to Chapter 5, it will be lined out, and this bookmark will allow it to come back, and this appropriation would be sufficient. Can you explain that, Steve?
Yes, Senator. The amendment here actually is, my understanding, is trying to move the appropriation of the $3.65 million that is right now currently on the Department of Corrections. So I believe the intent is just to move that appropriation to GMH. And as for the chair, we're going to bookmark, I believe, because we're at GMH now, and then when we get to DOC, that offset will take place when we get to that chapter.
But doesn't that immediately put our budget to be unbalanced, as you said before? And how we just can't do that separate. If we're taking this money from someplace to fund this, we have to see it right now. We have to make that decision all together. Otherwise, it's easy to just keep giving general fund money to GMH, and we're all going to do that. But if it's coming from somewhere, then let's just show that all together so that we all make that choice at one time. If you separate it, the budget becomes unbalanced for whatever period, and you run the risk that Second Amendment does not pass. We can't hold anybody to that in a future chapter. So I say, I don't know, Mr. Chair, I think that's how we've done it before. You said to show the funding source, so we should show it on the amendment.
I guess, Senator, that's why the good author is requesting to bookmark this particular chapter. So when we get to DOC, we'll make the corresponding offset.
Are we not going to do this amendment today?
No, we're doing this amendment at this time, Senator. The contemplation on the amendment is only that. If it doesn't pass, then there's really no need to even contemplate Chapter 5. But if it passes, then of course the money's going to go to Chapter 5. So that's why it's being bookmarked at this time, so that if the amendment is successful, we can go in, and when Chapter 5 comes up, the senator will line out the revenue source, and then
yeah, but that's going to require a separate motion and to pass. And if it doesn't pass, then we end up unbalanced. So that's why I'm suggesting, I think this is how we've always done it, and we need to do it, that we're going to show where it's coming from at the same time, and just do it one fell swoop. I think if that's
so what
the
we'll do is
intention,
we'll go to recess at this time. I'm going to request for the author to go ahead and pull up Chapter 5, even though we're not in Chapter 5, but pull up the section in Chapter 5 and go ahead and print the line out. We're in recess.